Hello there. Is that?
Oh, hi.
Hi there. I'm looking for Miss Jennifer Smith.
Yeah, speaking.
Good. Hello there. You have a telephone appointment with us this afternoon. Can I just confirm your full name, please, and date of birth?
Yeah, Jennifer Smith, 12/11/77.
And your address, please.
Fulham Palace Road in Hammersmith, W9 2FR.
Fantastic. Okay, just making sure that we have the right person. Now, because we're doing this on a telephone, I'm going to be typing up my notes at the same time, so you might hear me typing, and sometimes there might be some slight delay because I'm not very good at typing.
Okay.
Do we have your consent to share your clinical record with other healthcare professionals that might be involved in your care in the future?
Yeah, definitely.
Notes to your GP as well. Is that okay? Yeah, okay.
Sure.
Because we're on the phone, I'm going to use the speaker phone on mine, and I would advise you to do the same so that we can have our hands free as well. Is that
okay?
Yeah. So your GP has asked us to talk to you about your breathing problems. Can you just tell me a little bit more about what you've been experiencing, please?
Yeah, so probably a couple of months ago now, I developed a chest infection. It all kind of stemmed after we had a woman in. It was quite a dusty environment, and it really affected my breathing, and I was coughing quite a bit. And as the day went on, I was getting quite chesty. I was really struggling for a day or two, and then I saw the GP, who advised I've probably got a chest infection, treated me with antibiotics. It did settle down, definitely, but my breathing just hasn't been quite right since then. And it's nothing severe, but I can just know it's not right, and I get breathless every now and again. So I saw the GP again, and they referred on to yourselves. Okay.
So when you get this these breathing problems, do you make any funny noises going in and out of your chest?
Yeah, I think initially when it's particularly bad, especially when I'd first got the first few days, I was really quite what I would say was a wheezing noise, and you could definitely hear it, and I was struggling, and also a little bit bubbly.
Right, I see.
As well.
Okay, and was this at any particular day, time of day or night that you were experiencing these problems?
Obviously, initially, just after this workman had been, it was particularly bad. But I do find that now it's more so early in the morning. I'm waking up. I just have to get out of bed because I'm feeling quite breathless and starting coughing a little bit. So I tend to get up. But yeah, definitely first thing in the morning, it does tend to settle. But it's not every day. It's just every now and again that it's happening. But it is kind of a few times a week now that it is happening.
Do you have much of a cough?
I do. When at those times, yeah, I have a little bit of it's not productive like that other one I was having. It's just a little dry, tickly cough. But yeah, every now and again.
Does the cough ever wake you from sleep?
Not so much the cough. I do wake up every now and again, mostly just feeling a bit uncomfortable with my breathing, a little bit of a cough perhaps, but not really getting me up out of bed. Okay.
And when you are feeling breathless, does this stop you from doing any of your normal activities?
Not really. I think I'm managing to I probably do avoid going to the gym perhaps if on those days. So in a sense, yes. I'll just tend to try and get on with it as much as I can, but I tend to feel quite tired at the end of the day if I have been.
I see. Have you ever been diagnosed with asthma before?
No.
Is there anybody in your family with asthma?
No. No one.
Right. Do you have any other problems with allergies such as hay fever or eczema?
Yeah, I do. I have quite bad reactions. I've had a few reactions over the years, especially with cats and things like that. So I do have a cat allergy, hay fever, which seems to be worsening actually over the years, and horses. dust,
okay.
everything really.
Wow, okay.
So quite a few.
Right, right. And do you take anything for all these allergies at the moment?
Yeah, I tend to just take something if I get symptoms develop. So if I'm having a particularly bad day, I'm starting to get itchy eyes and runny nose, I'll start taking the antihistamine.
Right.
Otherwise, I wouldn't really take any.
Okay. So do you have any other medical problems as far as you're aware? No, you're not on any other
Nothing.
medications? You're not taking any other medication?
No.
Excellent. Okay.
No.
And
Nothing.
what do you do for a living?
I am a hairdresser.
Okay. Oh, and that's interesting. So do you find any of the chemicals that you use when you're treating hair, does that affect you in any way? Does that cause problems with your breathing?
Actually, yeah. So sometimes when we're colouring the hair, the strong smells tend to really catch my breath quite a bit sometimes.
Right. Does it make you wheeze?
Yeah. No, I don't think I've noticed. I have not that I've noticed.
Yeah.
No.
Okay. All right. Well, that's very useful. Now, before we sent you the appointment date, we also asked for your GP to supply you with something called a peak flow meter. Did you manage to get hold of one? Excellent. And we also asked that you look up the technique to use the peak flow meter over the internet on YouTube. When we sent you the link on the YouTube to demonstrate how to use it properly. Have you had a quick look at that?
Oh, no, sorry, I haven't.
Don't worry, don't worry. So we can just go through this right now, if you don't mind. So what I'd like you to do, we're going to test your breathing to see whether or not this is asthma that we are dealing with. First of all, I just want to see, to hear your normal breathing. So what I'd like you to do is just to take a really big breath in and then empty your lungs out slowly as well for me. So just, and then as well. So you hear. That's it. If you come, just get a little bit closer to the phone so that I can hear, to the microphone, so I can just hear how you are breathing out. So deep breath in again. Okay, so that's nice and clear. Okay, so with the peak flow, what I'd like you to do is to take a really big breath in, fill your lungs right up to the very top, full of air, then put your lips tight around the tube and then blast it out as hard as you can for me. Okay, so make sure that the pointer is back at 0 first. Make sure that the pointer is back at 0. Okay. So try and take a really big breath in. Yeah. And then open your mouth, put your lips around the tube, then blast it out.
Yeah. Okay.
Okay. Did you actually do anything then? Because I didn't hear very much.
I did. It's saying 140.
Yeah, it doesn't sound like. I think that you may not have taken a really big enough breath in, so I couldn't hear you really doing it as hard as you could. So this time around, make sure that you really take the biggest breath in as you can before you blow it out as hard as you can. So let's try again. So really big breath in. Oh, that sounds much better. Much better. What did you manage this time round?
320.
That's not bad. Not bad. I'm sure you can do better. Can we just have one more go, please? So really big breath in, right to the top, and then blast. Okay, that sounds a little bit better. What did we get this time?
310 actually.
310. Okay. Okay, just for luck, we'll just do one more because we always like to do the best of 3 blows. We'll take the reading for the best of 3 blows. So just do one more time for me, please. Right into the very top. Okay, that doesn't sound as good as the first one.
It's the same. It's 320.
320. Okay, so it's not too bad. So it's not quite as good as we'd expect. How tall are you, Jennifer?
I'm 170 centimeters.
170. And you were born in, what was it, 77, I think. So
77.
Yes, so your peak flow should be around about 400. So I haven't worked it out completely, but I think from rough guess, it should be around about 400, but I'll work it out a bit better when I get my calculator out in a minute. But it doesn't sound like it's as good as it should be. Yeah, but it's possible that you do have asthma. And the way that we're going to check whether you have asthma is to ask you to do the peak flow that you have just done twice a day, morning and evening, the best of 3 blows. And if you could keep a diary of the results over the next few weeks, then we can see the pattern of your peak flow over the course of time. And this will help us determine whether or not there is variation in your peak flow that would indicate that you have asthma. But in addition to that, we also, because you've been getting so many symptoms that sound like asthma, we're going to start you on some treatment as well. And then we can also monitor the effects of treatment to see whether or not the peak flow improves and along with your symptoms. Okay. So in order for us to choose what type of inhaler that you can use for your asthma, we're just going to do one little more test to see whether or not what device would be suitable for you. Okay. So this time around, rather than breathing in, I want you to breathe all the way out, and then I want you to purse your lips as though you're about to blow a kiss, and then I want you to suck in deeply and sharply for about 2 or 3 seconds. Okay, so I'm going to demonstrate. So empty my lungs. My lips pursed, and I'm going to go. Okay, so I want to see whether you can do that for me, please. So empty your lungs completely, and then purse your lips, and then then breathe in. Okay, didn't sound quite as hard as it could be, so just try that once again, but I want you to really suck in deeply and sharply. Okay, so breathe all the way out. Come closer to the microphone and then. Did something happen then? Could you not? Didn't quite hear that.
Let me come close.
Okay, maybe you're more suitable for an aerosol inhaler rather than one of the other ones that need a sharp. So instead of breathing in deeply, in this case, and sharply, what I'd like you to do now, instead of empty your lungs again, and this time round, just do a slow, and let's see, inspiration, a slow breathe in through the lips, and let's see how long you can breathe in for. Okay, so empty your lungs completely, and then that's it, and then now take a nice slow deep breath in. Okay, that sounds a bit better. I think that maybe rather than giving you the initial device, we might try you on an aerosol device with a spacer attached to it. So what we're going to do is ask your GP to prescribe you an inhaler that's brown in color. And we're going to ask you to take 2 puffs in the morning and 2 puffs in the evening, 1 puff at a time, through a tube called a spacer device. So all this is very confusing, but what you would like you to do is to look up on a couple of websites about how to use the inhaler with a spacer. Now, a website called rightbreathe.com. We'll write this in the letter to you so that. Good. So you can either look it up on rightbreathe.com or a website called Asthma UK. So they have videos to demonstrate how to use the devices correctly. So we would like you to take 2 puffs twice a day regularly. If you take the puffs, it would be useful for you to do the peak flow as well, so that if you do the 2 together, you won't forget. We can get a pattern of your peak flow over the next few weeks. So if you start doing the peak flow before you start the inhaler anyway, for a week or so, get the inhaler and then carry on doing the peak flow diary, and then we can see whether or not the brown inhaler makes any difference to your peak flow readings. Right? Then we can in a month or so's time to see whether or not things have changed.
Great, lovely. It sounds good. Thank you.
Do you have any questions to ask?
No, I don't think I do actually. I'll try that and see how I go.
So as soon as you get our letter, you know that the GP will have received the letter too. So contact you to get the brown inhaler. But in the interim, keep a diary of your peak flow readings. That'll be really helpful.
I will do. Okay, lovely.
Well, thank you very much. Take care.
Thank you.
We'll speak to you in about 6 to 8 weeks' time.
Great. All right. Thank you very much.
Bye bye now.
Bye. Bye.